Like many colleagues from across the House, I recognise that the issue of adult social care is one that's not easy to fix. It will affect many of our constituents at some point in their lifetime, and some of the barriers to care can be heartbreaking for families. In May this year, I'll stand down as a county councillor in Northamptonshire after serving 8 years. I was also leader of Northampton Borough Council for 4 years, so I've witnessed the way in which this system works firsthand. As a member of the Communities and Local Government Select Committee, I've also been part of a 4-month-long inquiry into adult social care, and we published an interim report ahead of the budget. I've also had discussions with professionals in the system, down from the Chief Executive of Northampton General Hospital to care workers. Mr Bailey, it's clear that the recently announced additional £2 billion for new money in social care is welcome, but I recognise this shows the government has listened to representations made by many members of this House and indeed the social care sector and the recommendations of the select committees. But no one on any side of this House is under any illusion that this will fix everything or indeed think that money is the only issue here. It's vital that we find a more sustainable way of paying for the increasing cost of social care over the long term, but we must also fix the systemic problems. I welcome the fact the government has said it will set out proposals in a green paper shortly. While short-term action is vital, there are funding, structural and other problems facing the social care sector in the medium and long term which need to be addressed, and it's important we have this full review of the service for the long term. We must move away from the debate that the entire sector can be saved with increased funding because the issues go much deeper than this. The idea of joined-up care must be exactly that. And I've lost track of the amount of cases where I've been working with families who are trying to resolve issues between the care provider, the local authority, or in some cases local authorities, and deal with multiple pressures of finding solutions, whilst at the same time as dealing with the emotions and trauma of an ill relative, sometimes with many complex or difficult medical conditions. The systemic problems in some cases can lead to the financial pressures that will only get greater as we have an ageing population, demographic growth, and enhances in medical treatment. In my opinion, we can often have too many organisations involved, with a poor family overwhelmed and simply unsure which organisation is dealing with which part of the care package and who they should be chasing to make something happen. The carers and staff involved are usually equally frustrated and concerned for the patient and the family. I think the Green Paper needs to focus on the structural barriers that prevent care packages being put in place or patients being discharged from hospital, and a serious examination of how the different organisations involved work together. In my opinion, this view must be a wide-ranging look at whether the current organisations involved are fit for purpose and whether the current splits between health and adult social care can be justified or how they should be reformed.
Louise Aylman.